Angina. Disclaimer: the information contained here should not be a substitute for the advice of a qualified licensed physician or other health providers. The information provided is for informational purposes only. Please check with your physician or healthcare provider with any questions or concerns. What is angina? Angina occurs when the arteries that take blood and oxygen to your heart become narrowed. Your body gives you a signal that there is a blood flow problem. That signal is called angina. Angina is a discomfort or a sensation that you feel. What is the cause? The heart muscle needs a constant supply of oxygen-rich blood. The narrowing is often caused by plaque. Plaque is made up of fat, cholesterol, and other substances. The plaque thickens and hardens the arteries. This makes it difficult for blood to get to the heart muscle. Most often plaque develops over many years. The following are some causes of plaque buildup: high cholesterol, high blood pressure, smoking, obesity, diabetes, and age. What does angina feel like? Angina is not always a crushing pain. It can feel like discomfort, fullness, pressure, tightness, burning, heaviness, squeezing, or an uncomfortable feeling that is hard to describe. Shortness of breath can happen on its own or with any of the above feelings. The feeling can be in your jaw, throat, neck, shoulders, upper to mid-back, chest, upper stomach, and one or both arms. Other symptoms that can occur while having angina are breaking out in a cold sweat, feeling sick to your stomach and or throwing up, feeling tired for no reason, and feeling lightheaded or dizzy. Angina may be brought on by exercise, emotional stress, or extremes of heat or cold. It may resolve within 5 minutes of rest. If it does not resolve within 5 minutes of rest, start the angina and nitroglycerin protocol. Angina symptoms vary from person to person, and it may resolve once the blood flow problem has been treated. If you feel angina again, it may not be the same sensation or in the same location. Notify your physician or healthcare provider if these symptoms occur. Angina and nitroglycerin protocol. When any cardiac symptom begins, activity should be stopped immediately. Do not work through symptoms. If symptoms do not resolve after 5 minutes of rest, sit down and take a nitroglycerin and wait 5 minutes to see if symptoms resolve. If symptoms continue, take a second nitroglycerin and rest 5 minutes. If symptoms continue after the 5 minutes, take a third nitroglycerin and wait another 5 minutes. If the discomfort continues after the 5 minutes, chew 325 mg aspirin and call 911. If you feel dizzy or lightheaded at any time after taking the nitroglycerin, call 911 and chew a 325 mg aspirin or 481 mg baby aspirins. Because nitroglycerin can lower blood pressure, it should be taken seated or lying down. It should not be taken within 24 hours of taking erectile dysfunction medication like Viagra and within 36 hours of taking Cialis. If alone when the pain occurs, secure pets if you have them and have the door unlocked for EMS prior to taking the nitroglycerin. Nitroglycerin is available in tablets and a metered dose spray. It should be taken under the tongue in a seated position. It works by opening up the blood vessels and lowering blood pressure. As a result, side effects can be lightheadedness or a headache. Nitroglycerin often burns and tingles under the tongue. If there is no burning, tingling or headache, consider that the nitroglycerin is not effective. It is a highly reactive compound and when opened the tablet should be replaced every 6 months. Discuss use of this medication with your doctor. If nitroglycerin is taken, never drive yourself or have someone drive you to the emergency room. Call 911 and wait on EMS to arrive.